I'm NAGA, one of the caregiver student in Filipino Institute, and I'm going to talk about late adulthood. Late adulthood periods that begins in the 60s and lasts until death. Late adulthood is the time of adjusting to retirement, decreasing strength and health, new social roles, reviewing one's life. Physiological changes, integumentary changes, skin for the skin, for the production of the new skin cell decrease, oil and sweat glands become less active, circulation decrease, hair loses color and loss occurs. Skin become less elastic and dry, itching is common, dark yellow colored spots appear, fatty tissues layer of skin diminish, lines and wrinkles appear, nail becomes thick and brittle, increase in sensitivity to temperature. Because skins for the late adulthood become sensitive to cold because decrease of metabolic rate. Circulatory changes, changes in cardiac output, all the structure of the heart also more rigid. Increase in diastolic and end-systolic left ventricular volume, diastolic dysfunction, decrease early diastolic filling, increased reliance on atrial contraction, increased vulnerability to congestive heart failure, especially with atrial fibrillation, decreased compliance of peripheral blood vessel, increased incidence of atherosclerotic cardiovascular disease, increased incidence of degeneration of cardiac conduction system. Respiratory changes, respiratory that is responsible for taking in oxygen, expelling with carbon dioxide we breathe. Respiratory muscle becomes weaker. Rib cage more rigid. Alveoli thinner. Alveoli's function pick up incoming oxygen, we breathe and release the outgoing waste, we exhale. Alveoli thinner and less elastic, which decrease exchange of gases. Bronchioli loss elasticity. Changes in larynx lead to higher pitch and weaker voice. Typical change as for the late adulthood. Chronic disease may decrease the efficiency of the respiratory system even more severely. Changes may cause the elderly to experience dyspnea, breathing increase in rate, difficulty coughing and secretion. Nervous system changes that coordinate all the activity of the body. Blood flow to brain decrease and there is a progressive loss of brain cells, interferes with thinking, interpreting, reacting, remembering. Decrease in the number of neurons. Decrease in brain weight and size. Decrease in neurotransmitter. Overall increase in risk of injury, loss of motor neurons, decrease in vibratory sensation, decrease in tactile sensitivity, decrease in proprioception. Sensory changes. Sense of taste, smell, vision, hearing are diminished. Decrease to ability to respond to pain and other stimuli. Decrease in taste of smell frequently affects appetite. Changes in vision, problems reading, and small print. Changes in hearing. Hearing loss usually gradual. Person may speak louder than usual or ask for words to be repeated, not hear by frequency, sounds, may not hear well in crowded places. Urinary changes. Kidneys decrease in size and become less efficient. Bladder become less efficient, may not hold as much, may not completely. Incontinence, decreased blood flow to kidneys, decreased kidney size and function, increased nocturnal diuresis, the involuntary urination that happens at night while sleeping. Digestive changes. Fewer digestive juices and enzymes produced. Muscle action becomes slower and peristalsis decrease. Teeth are lost. Liver function decrease. Dysphagia is frequent complaint. Problems to swallowing certain food or liquid. Less saliva because of lowered saliva production. loss of teeth, slower digestion of food, may not be properly breakdown due to missing tooth, indigestion, discomfort or pain in upper abdomen, constipation due to lower movement of lower gastrointestinal tract. Endocrine changes, increased production of some hormones and decrease of others, immune system less effective. Intolerance to glucose, decreased melatonin, sleep problem. More susceptible, burns, frostbite, cuts, fractures, muscle strain, and other injuries. For the psychosocial development, that includes achieving what Erickson called ego integrity. That feeling that one's life has been meaningful versus the despair. Despair is the feelings of regrets or bitterness about past mistake, missed opportunities, or bad decision. A sense of disappointment in life. Life review involves looking back on one's life experience and evaluation them. Integrity versus despair. Individuals engage in a life review that is either positive integrity or negative despair. So this is the psychosocial development of late adulthood. And they feel also the emptiness or the emptiness syndrome, a decline in marital satisfaction after the children leave the home. The feeling of grief and loneliness parents may feel when their children leave home. Dementia, loss of mental ability characterized by a decrease in intellectual ability, loss of memory, impaired judgment, personality change, and disorientation. Dementia is not a normal part of aging. It is a result of physical disease that damage the brain. The acute dementia, when the symptoms are caused by temporary reason, high fever, dehydration, and hypoxia. Chronic dementia, when symptoms are caused by permanent irreversible damage to brain cells. Alzheimer's disease, form of dementia that causes progressive changes in brain cells. Early stage memory loss. AD people may not recognize the family member. Mood and personality change. They may forget how to brush their teeth or comb their hair. Depression. Later on, they may be anxious or aggressive or wander away from home. Poor judgment. Confusion regarding time and place. Inability to plan and follow through with ADLS or activity daily living. Parkinson's disease. Parkinson's disease is a movement disorder disease. Parkinson's disease is a chronic progressive disease characterized by muscle tremors, slowing of movement, and facial paralysis. Several treatments are available. Parkinson's disease, foster independence with ADLS, avoid social withdrawal. This is Parkinson's disease nursing intervention, avoid embarrassment while eating. Soft diet, daily walking, avoid fatigue, physical and speech and occupational therapy, avoid constipation, stool softener. And for MD order, we can use that stool softener. This is this is the cycle of late adulthood, or the influence or the aging process of the late adulthood. And it is usually important to understand that there are certain individual difference in the aging process. We cannot compare a person similar age group. For example, if a person a 70-year-old and if you compare to the other person, we cannot say that aging process is equal among the individual. One may be having delayed aging process, or one may be had progressive aging process. And that's the late adulthood. Thank you for listening. Thank you for watching.